for having me. Yeah, I hope people aren't. I'll try and wake them up. If it's the last speaker of the day, then they might be nodding off, especially after lunch.
Well, to be perfectly honest, I think all our speakers have been so vibrant. Everybody's wide awake and really excited for your talk. Okay. So I'm just going to give you a brief. Yeah. I'm just going to give you a brief introduction, and then sure. I'll leave you to introduce yourself. So, excellent. For those people who don't know, Aseem is a National Health Service consultant cardiologist. He is also been an activist. Over the last few years, it's become apparent that doctors are not being allowed to treat patients in the way that they seem fit. So that is going to be Aseem's special subject for today: why honest doctors cannot practice honest medicine. So I'm going to leave the room and come back to you at the end, and we'll have some questions. So anyone with questions for Aseem, please put them in the chat.
Lovely. Thank you, Sally.
Thanks, Aseem.
So I will just see if I can share my screen first of all. Hopefully that will. So the title of my talk today, excellent. Okay, let me just go to slideshow. Hopefully that will come up in a second. Lovely. I'm presuming everybody can see this. Yeah, you can see my screen.
Yes.
Yeah, it's fine.
Okay,
yeah.
Brilliant. Thank you. So yes, very briefly, my background. So I qualified from Edinburgh Medical School in 2001. So I've been a qualified doctor for over 20 years. I subspecialized in cardiology, interventional cardiology. And then a few years ago, I decided to divert my attention more to prevention for reasons that will become apparent during my talk, but I'm sure most of you are probably already converts to understanding why that would be. And I've done a lot of different things over the years in terms of being an advocate on sugar reduction in this country. So I was the lead campaigner behind the sugary drinks tax. I've done a lot of work on trying to combat over-medication, helping coordinate a campaign between the BMJ and the Medical Royal Colleges. I'm also president of the Scientific Advisory Committee of a new charity called the Public Health Collaboration, which brings together doctors, patients, members of the public, really to advocate for more informed consent and healthy decision-making in terms of making sure people have the best available information when it comes to making decisions about their health. So as Sally already alluded to, the talk is really going to give an overview. There's going to be some, very briefly, I'll talk about some clinical scenarios, but the overview is actually why is it that honest doctors can't practice honest medicine, and really to help people understand the root causes, in my view, of what's behind our healthcare crisis and why we are not optimizing public health and patient outcomes. So I'll start with a quote: "What's worse than ignorance? The illusion of knowledge." And I'm sure this is something that is probably replicated through many countries in the world, but certainly in the UK, we've had a stalling in life expectancy for the last 10 years. And what's worse than that, in many parts of the country now, healthy life expectancy is reducing. So people are living, even though total life expectancy is stalled, people are living longer in poor health. So the question is, why is that? And that's really a really sad state of affairs that, with everything we're supposed to know in terms of modern medicine and science and the dissemination and access to information, why is it that people's health is actually getting worse? So let's start with this very elegant analytical framework for teaching and practicing medicine, which was originally put together over 25 years ago now. Professor David Sackett and colleagues put this triad together and wrote about it in the BMJ in 1996. And I think actually this is perhaps the most important slide of my whole talk, because once you understand this, then everything else makes sense. So as doctors, as healthcare practitioners, of course, our main duty and responsibility should be, and is, but I would say should be, because I don't think we're actually achieving this in the way that we should be, is improving patient outcomes. So what does that mean? It means treating illness, it means managing risks, and it means relieving suffering. And to do that, we incorporate three different modalities. So that's our individual clinical expertise as doctors, which is important to, that incorporates your experience as a doctor, but also your knowledge and your ability to communicate well with your patients, using the best available evidence, and then taking into consideration patient values and expectations. But if there's a problem with any of these three, then of course we're going to achieve suboptimal outcomes and even potentially cause unwitting harm to our patients. And the problem is that the best available clinical evidence has been hijacked by commercial interests, in particular when it comes to lifestyle, to a large degree the food and maybe exercise industries, and then of course the pharmaceutical industry as well. And then last but not least, if we don't actually take into consideration patient preferences and values, we're also going to achieve suboptimal outcomes. And that involves transparent communication of risk and benefit on any intervention. So really what we've now got is a healthcare system failure and an epidemic of misinformed doctors and misinformed patients. And a number of factors play into this. So the 7 sins that contribute to lack of knowledge and this misinformation, if you like, are biased funding of research. So that's medical research that's funded because it's likely to be profitable, not because it's likely to be beneficial for patients. Biased reporting in medical journals, biased patient pamphlets, biased reporting in the media, commercial conflicts of interest, defensive medicine, medical curricula that fail to teach doctors how to comprehend and communicate health statistics. That's certainly last but not least a major, major problem. And John Ioannidis, who I would probably describe as being a Stephen Hawking-like figure of medicine, because he's the most cited medical research scientist in the world, Professor of Medicine and Statistics at Stanford. This is an excellent paper that's open access, and I encourage everybody to read this because I think it summarizes a lot of the problems with modern medicine very well in just a few pages. And he talks about how to survive a medical misinformation mess, and he points out that certainly in the US, 20 to 50% of all healthcare activity brings no benefit to the patients. And the major reason for that is that most doctors don't know that much of the research they make clinical decisions on is poor quality and not reliable, offers no benefits to patients, and is therefore not useful to decision makers. Most healthcare professionals are not aware of this problem. Unless you're aware of the problem, the root cause of the problem, you're not going to be able to offer any solutions. So many people are not aware of this problem, and then they lack the necessary skills to evaluate the reliability and usefulness of medical science. And these are doctors we're talking about. And last but not least, patients and families then frequently lack relevant, accurate medical evidence and skill guidance at the time of medical decision making. And I can be witness to the fact that I've worked in the NHS for many years, but also I've been on many different committees. I've spoken to people in medical leadership roles, and John Ioannidis points out that ignorance of this problem is even at the highest levels of academic and clinical leadership is profound, and that is absolutely true. So don't presume that the chief medical officers or the chair of the CDC or the president of Royal College, for example, know this stuff. Don't presume that they know these things. In most cases, they don't. And John Ioannidis actually published something else. And I think this is important to try and have this concept in people's minds, because unless you start with this understanding, we won't be able to get very far in improving modern medicine. So this is one of them, I think the most cited paper in the last 30 years is called Why Most Published Research Findings Are False. And one of the criteria behind, which is really interesting if you think about it, in terms of what would be a factor in increasing the likelihood of a research finding being false, is that the greater the financial and other interests and prejudices in a scientific field, the less likely the research findings are to be true. So have a think about that for a few seconds. Is there anything at the moment that's become very, very, very profitable, probably one of the most profitable pharmacological interventions in the history of medicine? And how does that apply to these John Ioannidis's conclusions here? So I've I've been campaigning on this issue for many, many years. I even spoke in the European Parliament in 2018 at a lecture that was entitled Big Food and Big Pharma Killing for Profit. And a few key points again to try and bring us back to the bird's eye view, which I'm coming to during the talk, is we have to accept and understand that pharmaceutical companies and medical device companies have a legal obligation as businesses to make a profit and declare a shareholder dividend by selling their product. They are not required at all to give patients and doctors the best treatment, though many of us would like that to be the case. But the real scandals pointed out by Peter Wilmshurst, cardiologist at the Center of Evidence-Based Medicine 2014, is that regulators fail to prevent misconduct by industry, and that doctors, institutions, and journals that have responsibilities to patients and scientific integrity collude with industry for financial gain. And just trying to get some perspective of what is the end result of all of this, these problems with commercial influence over medical research. Well, we now have a situation where the third, according to Peter Gosha, the co-founder of the Cochrane Collaboration, the third most common cause of death after heart disease and cancer is prescribed medications, what your doctor prescribes for you. And most of these deaths are preventable if there was just better transparency in terms of their prescription. And the other major issue is that most of the top 10 pharmaceutical companies, these industries that have so much influence and power over our lives now, have committed fraud for a number of different misdemeanors, including illegal marketing of drugs, misrepresentation of research results, hiding data on harms, and Medicaid and Medicaid fraud in America. In fact, the total between 2009 and 2014, the combined total in terms of the fraud that had been that pharmaceutical companies had to pay for these sorts of misdemeanors was about $13 billion. But the issue is that this, for them, is the cost of business. When all of these big frauds were committed and they were found guilty of them, no top executives were fired, no one lost their job, they probably got bonuses. And then making more money, actually, from the drugs that they were found to have been fraudulently marketed. So it's a cost of business for them. And Peter Gosha points out that actually the real deterrent, or a better deterrent, would be that we need to hold accountable those executives so they would risk or think about the possibility of imprisonment when they consider performing or acquiescing in these crimes. So how good is modern medicine these days? How much has it contributed to improving health? Well, this is some interesting data from a paper published entitled Institutional Corruption of Pharmaceuticals and the Myth of Safe and Effective Drugs. And this looks at France, about 1,000 drugs that were approved by the regulator between 2002 and 2011. So the majority of them, just over 54% of those drugs, had no added value, no clinical benefit over previous drugs. So what normally happens is the drug industry will spend about 20 times more on researching new molecular entities than 20 times more in marketing than they do on researching new molecular entities. And what they end up doing is just changing a few molecules here and there in those drugs, and then patenting them. And by the time someone's figured out they know better than the previous drug, they move on to the next one. But I think what's most interesting and most concerning is that 15.6% of drugs were found to be more risk of harm than benefit, versus around 8%. If you look at significant clinical advance and some added therapeutic value, about 8%, a major advance, about 8% were of benefit. So you've got double the amount of drugs during that period of time that have been proven to be more harmful than beneficial. Most of the drugs are copies of old ones. So what do we conclude from this? And I'm very happy for someone to rebut me on this, but yeah, I've been mentioning this at several lectures recently, and this isn't just France, which I'll show you in a minute. The overall net effect, one could argue very strongly that the overall net effect of the drug industry in the last few decades on society has been a negative one. And you look at this is replicated in the US. So Marcia Angel, the former editor of the New York Journal of Medicine, her own analysis suggested that only 75% of drugs, again, in the same time period, were copies of old ones, of those 667 drugs that were approved by the FDA. What else does she say? Well, she said that it's no longer possible to trust much of the clinical research that's published, or to rely on the judgment of trusted physicians or authorities of medical guidelines. And she took no pleasure in reaching this conclusion, slowly and reluctantly, over almost 2 decades as an editor of the New England Journal of Medicine. She's not alone. Richard Horton, 2015, in an online editorial, in reference to a Chatham House Rules meeting that he attended with some very senior scientists organized by the Wellcome Trust, he wrote that possibly half of the published literature may simply be untrue. And in the UK as well, Richard Smith, former editor of the BMJ, wrote about the fact that there are many scandals in terms of in reference to universities covering up research misconduct in the UK, with some very prestigious institutions involved, which I won't name. But he also talked about the fact that when he was at speaking at a conference with a number of academics, he asked the members of the audience to raise their hand if they were aware of any colleague that had fabricated research in their departments. And a third of them put their hands up. And he asked them how many, keep your hands raised if you'd reported it or you're aware of anyone reporting it, and they all put their hands down. So how do we combat this? Well, one of the ways to combat it is certainly to raise awareness initially of the harms of over-medication, certainly for the general public and even for doctors. We'll talk about a little bit further shortly about addressing some of those root causes and understanding them better. But one of the things, initiative that's been originally started in Canada is called Choosing Wisely. And I spent several months working with the medical Royal Colleges, and I was lead author on this BMJ paper, where I was able to lobby and speak to the chair of the General Medical Council and the chair of the Medical Royal Colleges, arguably two of the most important doctors in the UK. And it didn't take long to convince them that this is a major issue in terms of too much medicine. So this paper was published in the BMJ, and we wanted to really launch a campaign to highlight the harms of too much medicine and reduce over-medication. Certainly in the UK, it was suggested maybe 15% of all NHS treatments and operations were unnecessary. And this also, it's not just about the over-medication, over-treatment. If we're spending a lot of time and resources on interventions that have been proven not to be particularly beneficial, and certainly there is no informed decision-making going on, then what happens is you're in a healthcare system with limited resources, one doctor's waste becomes another patient's delay. And one other way, which I then subsequently, a couple of years later, in another paper with Professor Dame Sue Bailey, who was the chair of the medical colleges, we wrote in the Pharmaceutical Journal about the fact of shared decision-making actually could reduce overuse. Just even the published data, which of course is biased, even translating that information into a form that is understandable to patients by using something called the numbers needed to treat or absolute risk reduction, would in itself likely save billions of pounds and improve patient outcomes. And we talked about, in fact, a case study. This is a patient I saw called Tony Royal, who, fascinating patient. He was a former international airline pilot with the Virgin Atlantic. A few years ago, he came to see me. He had actually suffered a heart attack, luckily not when he was flying, and had coronary stenting done. Up to that point, he had been following a lifestyle of nothing, particularly bad, following the dietary guidelines, which is a very high starchy carbohydrate diet, was running marathons and putting on weight, and then suffered a heart attack in his mid-50s. And then he was able to read some of my work. He was put on a cocktail of drugs. He didn't feel he was getting any better after he was put on this cocktail of drugs, and he ended up getting side effects from statins. Now, Tony's a very interesting, unusual type of patient because he could no longer fly, but he was previously a maths and physics teacher, and he was very statistically and health literate. So he started reading the research himself in terms of the drugs he was taking, and also looking at some of the evidence on lifestyle based upon my publications and some other people in the field of obesity research. And over a period of around 18 months, he gradually stopped all his medications. He came to see me asking me whether he could do an ultra marathon, which I thought was quite extraordinary. And we had a discussion. I wanted to make sure that he was fully informed about what he was doing. And I've been in touch with Tony. In 6 years, he's off all medications. Having had a heart attack, he's breaking his own records in ultra marathons, and his overall metabolic health, which is the major issue in terms of risk of heart disease, probably even cancer, certainly linked to diabetes, is now optimal. And it's quite extraordinary. So the reason we talked about this in our paper, in this editorial, was to show that when you inform patients fully and they understand the numbers needed to treat, and they adopt a lifestyle, extraordinary things can happen. And this is really just a case study to highlight what can occur if we focus more on lifestyle rather than medications. It was press released and it became a front page news story of the Daily Express, and even the Daily Mail covered it as well. I thought that was quite a nice provocative title. Ditch the statins and eat your way back to good heart health, experts controversially claim. Okay, so let's just get back to tackling some myths. One of the reasons why I think that we have this perpetuation, if you like, of a misunderstanding about what modern medicine can achieve is because of a culture and advertising, and certainly a false belief that modern medicine is better than it actually is. So this was an analysis published in the Journal of Community Medicine and Health Education, where they looked at a sample of 705 adults who all were educated, and just asked them the question, in the last 150 years or so, we've added about 40 years to our life expectancy, and how much did they believe from the survey was attributed to modern medicine? And 80%, well, most of those people thought 80% on average of our life expectancy increase was because of modern medicine. So 32 of those 40 years. So our average life expectancy, say in 1850, was 40 years. Now it's about 80 in the Western world, and nothing could be further from the truth. The actual figure was about 3.5 to 5 years. And I think the point of the paper was really just highlighting that because of these misperceptions, it would hinder adequate public health funding and efforts to address important health-related social issues, and therefore, resources being distributed unequally is partly because of misinformation. And certainly this would probably apply to policymakers as well. And of course, most of the increase in life expectancy in the last century, certainly, and beyond, because of public health advances, which were essentially underpinned by regulation. So safe drinking water, seatbelts in cars, safer working environments, taxing of cigarettes, for example, tobacco control. So the single biggest intervention in terms of reducing cardiovascular death rates in the last 3 decades has been taxation of cigarettes. So these population-wide interventions. So the point here, and this is a hint to what's coming later, is if you think about it properly, most of what has had an impact on our quality of life and our longevity has been changes in the law. Changes in the law. So this is Tom Friedman's Health Impact Pyramid, and it really just highlights what has the biggest impact on population health. So, telling people to eat healthy, be physically active, even if we had all the right information in itself, is very minimal impact. And the reason for that is our environment has a much bigger impact on our health behaviors than we probably appreciate. Our health choices are structured by forces that are often beyond our immediate control. So if you look at changing the context, for example, it was 50 years between the links between smoking and lung cancer were published before any effective regulation that then drove down smoking prevalence, which was around 50% in the 1970s in terms of adults in the UK, and now it's around 17%. And it only happened after, of course, education is important. Let's not deny the importance of education, but unless it's underpinned by measures that are going to make the default choice a healthy choice, then it's going to have very little impact. So you can see that from the health impact pyramid. Now, at the bottom of the pyramid, and this is what I want to talk about now in a little bit more detail, is this slightly vague term, socioeconomic factors. So that's interesting if you think about it. What does that mean? So how can socioeconomic factors have the biggest impact on your health? Well, it hasn't been very well defined, I think, in the last few years. They talk about poverty, education, housing, and inequality. So what's really going on there on a biological level? Well, I think it's better to describe it or define it more as a biopsychosocial model. So actually, chronic psychological stress, of course, linked to other lifestyle factors, is probably the missing link. And we now know that if you have chronic psychological stress, which is affecting many people in society, certainly from a heart disease perspective, it's equivalent to having a risk factor for heart attacks. So having high blood pressure or type 2 diabetes or being a smoker. And there's even quite good evidence now that if you suffer from chronic psychological stress, then it will have an impact on the aging process. And at extreme levels, for example, if you're a mother of a child that's disabled compared to a mother of a child that isn't disabled, then that can actually accelerate aging by about 9 years. If you're a child that's a victim of severe psychological or physical or even sexual abuse, at the extreme end, it's going to knock off 20 years from your life expectancy. So, this is because those environmental factors that are involved in the way we are, in terms of the way we grow, live, and work, actually have an effect on epigenetics and genes that contribute to chronic disease and aging. So this is also now well established, certainly in the literature, that the way that chronic psychological stress works is that, certainly when it comes to heart disease, it increases thrombotic factors in the blood and chronic inflammation. And heart disease now is considered a chronic inflammatory disease, which is influenced by metabolic risk factors. But of course, if you've got increased factors involved in clotting, it's particularly fibrin in the blood, which has been also shown looking at people who are in high demand, low control, low paid jobs, then you are automatically going to be at an increased risk of having health problems. So Michael Marmot, who's really the guru, the public health guru behind a lot of the research around the social inequalities, this paper that he was involved in, which is quite extraordinary if you think about it, he said 1/3 of premature deaths are linked to social inequality. So if you accept that chronic psychological stress is a major risk factor for ill health, well, what's very interesting is social inequality. So the bigger the gap in a population between the rich and the poor, the greater the chronic psychological stress for everybody. And it's something called status anxiety. And this is a really excellent book, very well researched. The two leading research in this is are Richard Wilkinson and Kate Pickett, called The Inner Level. And this book really explains how the inequality affects us individually. So it alters the way we think, feel, and behave. It sets out the overwhelming evidence that material inequalities have powerful psychological effects. When the gap between rich and poor increases, so does the tendency to define and value ourselves and others in terms of superiority and inferiority. And we have a lot of data showing that low social status is associated with elevated levels of stress, and our rates of anxiety and depression are intimately linked to the inequality which makes that status paramount. So I think in terms of when we think about how we want to improve population and societal health, we also need to think about these issues around economic and social inequalities, because if we narrow those gaps, we are going to improve the health for everybody. And there's lots of data around the world. If you look at more egalitarian societies, for example, Scandinavian countries, independently, you can see that those societies, the quality of life and years of life in good health are actually better. What else does Michael Marmot say? And this is very interesting. When you listen to politicians saying we're creating jobs, we should ask them the question, it's not about what jobs, about the jobs you're creating, is what's the type of job you're creating. So if you think of these big corporations, a lot of them, they exploit their workers. They have people on minimum wage or even less than minimum wage, and it's effectively a death sentence. So a poor quality or stressful job can be more damaging to health than being unemployed. Okay, let's just take a step back a bit further now. Getting further into the root cause of these problems. So we need to think about the commercial determinants of health. So this is defined as strategies and approaches adopted by the private sector to promote products and choices that are detrimental to health. And this is a really nice framework showing how do big corporations exert power, so much power over our health. And there's a number of different dimensions. So the one-dimensional view tells us they have power of decision-making and control of the political agenda. The two-dimensional view is that power to define issues and potential issues. And the three-dimensional view is power to avert conflict and keep conflict latent. So that's conflict between the interests of the powerful and those whom over power is exerted. So how else could we describe that? So the general population doesn't know what's happening. You can apply this to doctors as well, by the way. The general population and doctors don't know what's happening, and they don't even know that they don't know. So the vehicles of power that the corporations utilize are political environments. So this can be through lobbying, It can be through tax avoidance. It can be through preference shaping. So this can be through corporate foundations and philanthropy. Think of Bill Gates, for example. Bill Gates has a lot of influence now in the world. How many people know that Bill Gates, the Bill and Melinda Gates Foundation, is heavily invested stocks in McDonald's, Coca-Cola, and the pharmaceutical industry? He doesn't talk about managing chronic disease. He's not interested in chronic disease. So, that's a huge bias. Capture of the media, certainly in America, 80% of broadcast and print media is owned by 7 corporations. So what we've got essentially, these very powerful vested interests that are only interested in making money, and then they utilize everything they can to influence our behavior and influence the narrative. They capture the knowledge environment. So funding of medical education. Most of the research in medical research is now funded by the pharmaceutical companies. So that's a big problem, because people then are only getting one version of the truth. It isn't the totality of evidence. And of course, that's shaping doctors' clinical decision-making. And therefore, we're leading to suboptimal outcomes. Limited liability, of course, as well, is a big problem. We've seen that certainly with the issue around concerns that people have raised around the rollout of the vaccine, that governments granted the fact that these companies weren't liable if there were any harms that were going to ensue on population and individuals. And then extra legal environment, so opposition, fragmentation, illegal activity, and tax evasion. So opposition fragmentation often involves targeting public health advocates and doctors, for example, who are going to call out the industry. So they will launch smear campaigns, they will use the media. Certainly we've seen in general throughout the pandemic, whether it's about whether we should have had lockdowns or whether we should be mandating vaccines, we've seen the use of social media, which I've never seen before in my life to this degree, suppress even information through social media. And then what are the outcomes of this power? Well, this determines what we call the macrosocial determinants of health, the biopsychosocial commercial determinants of health, if you like, which then influence the risk factors for disease and then have a negative impact on population health. So the real issue, what we should really be focusing on are the commercial or corporate determinants of health. 2012, this is a great paper in the BMJ where Jared Hastings points out that actually corporate power should be and I would say the public health priority. All of us should be talking about corporate power now as the real root cause of many of the problems that we're experiencing in modern society, certainly in terms of health. And what we need to do as public health advocates, as doctors, is take the lead in a movement away from a world driven by abeyance to the corporate bottom line and to the enrichment of an elite, to one that prioritizes physical, mental, social, and planetary well-being. The World Health Organization have an excellent, I don't think the World Health Organization, I'm sure you'll agree with me, do everything right, but they do a lot of stuff right. And one of the things I think is really useful is their definition of health, which is a state of complete mental, physical, and social well-being, not merely the absence of disease. So I think when we talk about health, if we think about that definition, then it allows us to go down that avenue of understanding the wider determinants of health. Most of what determines our health is actually the environments in which we grow up in and our social interactions, what we eat, those sorts of things. And the other thing to mention as well, just briefly, I'm a big advocate for the NHS. I know the NHS is struggling at the moment, but it's struggling because it's not actually behaving like what it was set up to be, which was to universalize the best health for all. Not just about allowing everybody to have access, because I think it's a human right that people should have access to good quality healthcare. It's about, the best quality healthcare. So that's where NHS hasn't innovated. But the reasons for that really are because there is too much commercial influence and a culture within the NHS that has become corporatized. And we know from, there's very good evidence as well, just trying to bust some myths here, that when you have privatized healthcare in general, the costs go up and the quality goes down because they're profit-making businesses. And of course, if you have a commercial influence over healthcare, which is obviously very apparent in the United States, then there's asymmetry of information. And then even the rich and the poor are going to be exploited for that, because everybody suffers and the quality of care goes down. So coming back to some examples of what happens, the type of behavior of many of these big corporations. So some of you may be aware that the Vioxx scandal, the drug that was marketed and improved in the late 1990s, early 2000s, which was thought to be a better anti-inflammatory than ibuprofen, because it was thought at the time when it was marketed that it would, excuse me, reduce the side effects from the gastrointestinal tract, in particular stomach bleeds. Ultimately was found to be fraudulent. So increased cardiovascular events. It's thought that drug killed 40 to 60,000 American citizens, probably about 200,000 people worldwide. And John Abramson on the right here, who's speaking to Joe Rogan, who is a doctor at Harvard, had done a lot of work in drug litigation over the years. He's a colleague and friend of mine. Very interesting in this interview, he talks about when it was exposed that Merck, the drug company, had been fraudulent, had been found guilty of fraud in terms of their drug, because they'd only published selective information on the drug when they had information showing it was going to increase cardiovascular events. During that trial, an internal email revealed that the chief scientist of Merck had written, when the drug was being approved, by the way, obviously revealing that they were aware, he wrote in an email, "It's a shame that the cardiovascular effect of the drug is there, but the drug will do well and we will do well." It's quite extraordinary if you think about it, isn't it? That this is, so the question is, what do you call that kind of behavior? Forensic psychologist Dr. Robert Hare, behind the original DSM criteria, in fact, and a big influencer in the DSM international criteria for psychopathy, actually in the book The Corporation, written by Joel Bakan, says very clearly that many of these big corporations actually, as entities, I'm not talking about individuals here, they function as psychopaths. Okay, so what does that mean? Well, callous unconcern for the feelings of others, incapacity to maintain enduring relationships, reckless disregard for the safety of others, deceitfulness, repeated lying, and conning others for profit. Well, I think we can all understand that. So I've come up with this new, I just wonder whether we should think about these corporate, when we talk about public health priority as corporate power, should we be talking about now the psychopathic, we talk about socioeconomic factors, social determinants of health, should we be talking about the real root cause of the problems is the psychopathic determinants of health? Is that what we should really be? Because certainly as an entity, the corporation has no moral conscience. It's literally there as a money profit-making machine and will do anything and everything to make money. So to try and understand many of the issues, certainly in what's going on in the world right now, to understand why there's certain things that are happening that are completely incredible, once you realize that the root of the problem is a psychopathic entity that's influencing and controlling our lives, it all makes sense. And then we can work on doing something about it. Just to mention, interestingly, how many people are aware that Merck has actually been working with Facebook and has spent, $40 million with Facebook for advancing health online? So this was an online publication. You can look this up. So June 2021, Facebook and Merck have committed $40 million to a multi-year initiative of establishing the Alliance for Advancing Health Online. Very interesting. The initiative will initially focus on addressing vaccine hesitancy and vaccine equity amongst undeserved communities. Well, so that's interesting. So what happens when you partner with an entity that has a history of essentially only caring about profit and being anti-human? Well, what's going to happen? Well, it doesn't take a rocket scientist to work it out. So I myself as well, I've been a campaigner on the issue of saving the NHS and for well over a decade. And one of the things I saw as a jobbing doctor, why I got down this space as being an activist, certainly in terms of tackling obesity, is I could see that patients were getting worse. I understood the literature, 10 years ago and what was going wrong and what we need to do about it. And I was concerned that if we didn't address it head on, then the NHS would be beyond breaking point. It would collapse and would fail to even provide basic quality care. But even in my worst nightmare, did I not expect it to be failing in emergency care, which is what it's doing. So I sadly have lost both my parents in the last few years. Both of them were doctors, both general practitioners. And I wrote about what happened to them. One was a front page story of the Eye. It was used by that newspaper at the time, actually, the article I wrote just before the general election of the last, conservative general election when Boris Johnson was became prime minister. And, I think the Eye wanted to use my story about what happened to my mum, who, went into hospital with infection in her spine. During her stay, heart attack was missed because the doctors were too busy. I actually diagnosed it when one of the doctors sent me the echocardiogram report she had done. And then what happened was she went into pulmonary edema, so she had fluid in her lungs. My poor dad and his best friend were sitting by the bedside for 2 hours before she was treated because they were too busy. So this is a reflection, as I said earlier, one doctor's wasted another patient's delay. We have the solutions, even without putting more money into the NHS, to dramatically improve quality care and make care make care more timely. She probably would have died at the same time, but she wouldn't have suffered in the way that she did. Very sadly. And then my father suffered last July a sudden cardiac arrest, unexplained, and it was witnessed. And I was down the line on the phone, and he had we called an ambulance. Well, the two doctors with him that witnessed it called an ambulance. Normally ambulances should come within 8 minutes. They didn't, and they took 30 minutes to come. I thought he would be fine because it was a witness cardiac arrest. I've published and I've done a lot on cardiac arrests in terms of understanding how outcomes can be improved. And he was in the best possible situation he could have been in many ways. But the ambulance took 30 minutes. And I then wrote about how I was informed not long after that the Department of Health and the government had actually were covering up information for several weeks across the country, where they knew that ambulances were not arriving in a timely fashion for heart attack patients and cardiac arrests. And if we had known that, I spoke to my dad on the phone who had chest pain. I wouldn't have, neighbors would have taken him straight to hospital. He would have probably been by a defibrillator when he had a cardiac arrest and survived. And he didn't because we thought the ambulance would come. This then became, I was the first person to expose this problem in the NHS. And I remember, when all this happened, it was obviously very upsetting for me. I had an older brother that died when I was young, so my dad was my best friend, my last surviving member of my immediate family, and obviously I was quite emotional about the whole situation. And I contacted a very senior NHS cardiologist, one of the good guys, just after it happened, to say, listen, Prof, do you agree that, I'm quite emotional about this, I'm a cardiologist, I know this stuff, but do you agree that if Dad had a defibrillator, the ambulance had come in time, he would have survived? And he agreed with me. And then I said, well, listen, this is actually what's happened. There's a cover up here. And he said to me, he texted me. This is, by the way, a very senior NHS cardiologist. And he said, I wouldn't expose this, Aseem. You're only going to make yourself enemies. So, this is one of the good guys. I'm not blaming him, but, think about what is going on for somebody in that sort of leadership role to be telling another doctor to not expose clearly something that's in our duty to inform the public and other doctors about. And and my personal view is that the culture that we've had increasing over many years because of this unchecked power of corporations has infiltrated where people will turn a blind eye. People are worried more about maybe you losing research funding related to the drug industry, for example. But I think, this is the end result of this sociopathic, anti-human, psychopathic culture that's seeped down into the way that many, many people are behaving, not because they are bad people, but because that's just the culture that has just increasingly influencing our lives and ultimately damaging patients and doctors as well. Because, if we don't focus on improving patient outcomes, we ultimately are going to suffer as well, because those patients are going to get worse. And now doctors can't cope. Morale is down. Doctors are struggling because the patient's health is getting worse, because they have been misled over a number of years, because they don't understand what's at the root of the problem. And then ultimately, it did come out that what had actually happened. The ambulance service apologized, and it was actually a private provider within the NHS who had staff members that were, probably on very low pay, not as good quality, because, it's a private companies are there to make money. So what do? Well, they pay their staff the lowest. They get poor quality staff. They pay them less. And there was an error made in terms of even the dispatch of the ambulance from the call handler. Okay, so we're getting towards the end of the talk, so I'll just try and finish up. So what do we do? Well, I think first and foremost, we need to start talking about real evidence-based medicine, because evidence-based medicine has been hijacked by commercial influence. So let's just go back to the basics: individual clinical expertise, application of individual clinical expertise with best available evidence, and then take into consideration patient preferences and values in order to improve patient outcomes. It makes the ethical care of the patient its top priority, demands individualized evidence in a format that clinicians and patients can understand, shares decisions with patients through meaningful conversations, and then builds on a strong clinician-patient relationship and the human aspect of care. And we can apply these same principles for evidence-based public health policy. Now, what else should we be doing? Well, I think enough is enough. Although the pharmaceutical industry plays an important role in developing new drugs, they should play no role in testing them. And they certainly shouldn't be able to then hide onto the raw data and keep it commercially confidential. So we're just really relying on summary results of what they're telling us. And then the regulator itself, I haven't mentioned this, but they also shouldn't be getting funding from the drug industry. Most of the regulators now get most of their funding from the drug industry. All results of all trials that involve humans must be made publicly available. And then regulators such as the FDA and the MHRA must be publicly funded and not receive any money from the pharmaceutical industry. Independent researchers must increasingly shape the production, synthesis, and dissemination of high quality clinical and public health evidence. Medical education should not be funded and sponsored by the pharmaceutical industry. I've stopped going to cardiology conferences now that are sponsored by the drug industry because I don't know what to believe. And to be honest, I know that most of the information being presented there is biased at best and false at worst. And then patients, we need to empower patients. We need to ensure that they know about this, because then they will demand better evidence, which is better presented using absolute risk and not relative risk. And then applied in a more personalized way. So how do we do this? Well, it's great having the science alone isn't enough. Opposition from vested interest needs to be overcome. And in my role of being, say, tackling sugar, for example, one thing I learned is, this is something that came to me recently, but in fact, I utilize these, utilize this triangle that moves a mountain, which is developed in Thailand, to move this mountain. So first of all, we need the right information. So the knowledge has to be concrete and reliable and independent. Then that has to combine with the social movement, which is something obviously that you are doing, in this through this conference as well. I think it's a really important initiative that increases awareness and disseminates this information to as many people as possible. But crucially, and this is a challenge, is political involvement as well, because ultimately it's politicians that have control over laws and resources and how they're allocated. And although we can definitely affect many lives on an individual level, we are not going to be able to tackle population health unless we make sure political action is taken to protect the public from the excesses and manipulations of the food and the pharmaceutical industry. So what else should we be doing? Well, I think the field of public health, we need to refocus our research program. So instead of focusing on individual risk factors, which we have been doing and putting a lot of priority on that, whether it's medications for blood pressure or diabetes or whatever, we should be shifting more focus to the social, commercial determinants of health, and understand that that we have to be addressing those issues head on if we're going to improve population health. We need to reframe our way of thinking about and acting towards corporations. We need to understand that they are anti-human in the way they're operating. They're just profit-making businesses. And then disconnect our research programs. So we should not be getting any funding. Institutions should just refuse to take funding from the drug industry. We need to be focusing on more publicly funded research. And by the way, people say, well, hold on, where's the money going to come from? Well, it's interesting. About $3 trillion apparently is hidden in tax havens. Big corporations aren't paying tax. So what they do is they use these people who work within these companies, use public services, yet don't contribute to them. So there's a lot of money. The money's just in the wrong place. The money's there. The money's just in the wrong place. And it's being, and it's kept in the wrong place by illegitimate, undemocratic means. And then we need to redesign the corporation, of course, and make sure that those corporations, that they are monitored for the impact of the products they produce. Because at the moment, what happens with many of these corporations is that they market unhealthy products, or deceive people about the benefits of drugs or the safety of drugs, for example. They exploit their workers, and then they have a negative impact in society. So we need to reverse that. We need to make sure that in general, people are paid enough so they can at least lead a life that they want to live, which is allowing them to have basic, good quality food, and have be able to afford to have a decent quality of life. And we haven't got that, so we need to focus on that, and we will then have a much bigger impact. We need to think about ethics and spirituality as well. The late Robert Kennedy, I love this quote of his, and this is very relevant to what's going on now. He says, the gross national product does not allow for the health of our children.
the quality of their education or the joy of their play. It does not include the beauty of our poetry or the strength of our marriages, the intelligence of our public debate or the integrity of our public officials. It measures neither our wit nor our courage, neither our wisdom nor our learning, neither our compassion nor our devotion to our country. It measures everything, in short, except that which makes life worthwhile. And we have to start teaching our children and thinking about, you know, to lead the good and happy life. We've got all this ancient wisdom that teaches about virtues. You know, Plato, evolving from Socrates' 5 virtues, you know, wisdom, courage, moderation, and justice. And of all the virtues, the most important one, all of us to think about and to teach our kids about, is courage, because without courage, you can't practice any of the other virtues consistently, you know, as pointed out by Maya Angelou. So courage is the most important of all the virtues. So we need to, you know, there's another line I use, which is great, you know, just to summarize, you know, how we should apply ourselves when we understand what's really going on. So knowledge without action is vanity. Action without knowledge clearly is insanity. But wisdom without courage is fruitless. Unless we act upon this information and have courage of our convictions, it's essentially a waste of time. And we're not going to be happy further down the line when we think we should have done more and we didn't. You know, and that's what I try and do. Certainly, I've been trying to do throughout many years as an activist. Abraham Lincoln predicted the problem we've got now actually is not that new. I see in the near future a crisis approaching that unnerves me and causes me to tremble for the safety of my country. Corporations have been enthroned and an era of corruption in high places will follow. And the moneyed power of the country will endeavor to prolong its reign by working upon the prejudices of the people until all wealth is aggregated in a few hands and the republic is destroyed. So it's time to rise up against the organization of misery. And I'll just finish with a quote from one of my inspirations, Mahatma Gandhi, and it is health that is the real wealth and not pieces of gold and silver. Thank you very much.
Thank you so much, Aseem. That was really interesting. And I got so many comments in the chat saying, from everyone listening, saying how interesting it is. And for, I can see Hugh's giving you a round of applause. And I'm sure you won't be alone. I just want to say I'm so sorry for what happened to your parents. That's, you know, utterly so frustrating when, you know, their deaths clearly were premature, and with better sort of care and intervention, they would still be here. So I'm sorry about that. And actually, somebody has asked in the chat, did you find out what caused your dad's heart attack? And do you think it had anything to do with the corona jab?
So I'd rather not comment on this right now, but let me just say that his, so he didn't actually have a heart attack. His post-mortem, which I wrote about when I you know, exposed the ambulance delay crisis, his post-mortem showed that he had 2 critical stenosis in his coronary arteries. For me, what was particularly shocking, and I'm, by the way, you know, at the forefront of changing the paradigm and the understanding of how heart disease develops, how we can prevent it, and even reversing heart disease. So I've written about that and published in medical journals and created a lot of noise around that. So I understand probably better than anybody how coronary disease progresses. My dad was a very fit 73-year-old. He was walking 10 to 15,000 steps during lockdown. He suffered from a bit of mild raised blood pressure. There's no family history on his side of heart disease. It was his whole circumstances of his death were very, very unusual. He had what we call mild angina for the first time. Then he had a cardiac arrest, which doesn't usually happen in those circumstances. And then I was expecting to find a small heart attack, and there wasn't, but there were 2 severe narrowings. So let's put it this way. There was no reason for him to have such a rapid progression of coronary artery disease when, you know, I'd done scans on him just routinely. We'd done some stuff a few years ago. So it's not fully understood yet. Let's put it that way.
Okay, well, yeah.
But so, let's just say very soon, I'm sure, I'm just putting a few things together, piecing it together. And I'm sure very soon I will have a more definitive answer of exactly what caused his cardiac arrest or what led to it. And then I'm very happy to share that with everybody.
Thank you for that, because yes, mysteries, there's a lot of mysteries around a lot of deaths at the moment. Somebody else has asked a really interesting question. Tobacco was a part of the materia medica in North America for asthma treatment and other lung and respiratory maladies. Do you think it's the treatment and pesticide use that goes into tobacco has given it a bad reputation now in modern day?
I'm not aware of that, so I wouldn't be able to comment. The only thing I would say in reference to that, I hope I'm not digressing too much, is one of the battles, I think people need to understand something called the corporate playbook. So there's a paper, if you want to understand the tactics, because you understand the tactics of the corporation, you see it then all happening, playing out now, whether it's drug industry or food industry. So there's a paper written by Kelly Brownell, professor formerly of Yale and now at Duke. It's a brilliant paper, which I read, and it gave me all of my ammunition when I was taking on the sugar industry. So it's called Big Tobacco Played Dirty and Millions Died. How similar is big food? And in that, and there are lots of examples of it, I said it was 50 years between the first links between smoking and lung cancer were published before any effective regulation. And what the tobacco industry did to avoid any regulation was they planted doubt that cigarettes were harmful. They denied it completely. They confused the public. So it confuses the public if you got, and then they bought the loyalty of scientists. And in reference to the question, buying the loyalty of scientists, so they would get people, they would pay scientists to publish in prestigious medical journals saying that smoking was good for you. Or saying that actually the cause behind heart attacks is nothing to do with smoking, it's stress, and it's just a coincidence. People who are stressed are smoking more. So they did all sorts of stuff like that. And I think the reason that's important to understand is a lot of the research and a lot of stuff that's being published at the moment on certain very topical issues in medicine, let's put it this way, is deliberate, in my view. People being, taking money and obfuscating and distracting and giving, drawing conclusions about certain diseases or certain things that are happening to people that are completely opposite to the truth as a form of distraction. This is all part of the corporate playbook strategy by the big corporations. So just remember, please, if nothing else, the one thing I want people to take away from this talk is that we need to tackle the psychopathic determinants of health if we're going to improve population health.
I think that's true. And, I'm so pleased to hear you calling out those conflicts of interest, which are myriad, as we know. And I wonder how conflicted you feel as a sort of cardiac specialist in the NHS, clearly advocating for functional medicine. And you're in an organization who would do anything to try and dissuade you. So, how is that conflict for you? How easy is it having a foot in both camps?
It's a great question. So in terms of clinical practice, it's never been an issue. So I've never had, I'm lucky, I think, which is unusual for a doctor who's qualified for whatever 20 years. I've not had a single patient complaint ever. Because, for me, it's the conversation with the patient all comes down to what are their preferences and values. And then whether it's, say, for prescription of statins, I will break things down in a way for them that they understand. And that then is, no one can argue with that, because then they make a decision. They don't want to take a statin drug for heart disease, for example, whereas another cardiologist may be saying stuff like, take this or you will die. I will frame things differently. So it hasn't been a problem in terms of clinical work. I've never been approached, certainly within the hospital, or somebody saying to me, I don't like the way you manage that patient. In fact, the contrary, my patient outcomes are probably as good, if not better, than others. But it's more the external attacks. So I've had lots of those. I've been on the front page of different newspapers, effectively calling me a dangerous doctor. But I think people, I'm paraphrasing Jordan Peterson here. Speaking the truth is not safe. But not speaking the truth is even less safe, right? Because if you don't speak the truth, then the issue is only going to magnify, and then it's going to hit more you and other people, and maybe your children further down the line. So, and also, I think what I would say is that, there's the lead campaigner in Australia, Simon Chapman, who was behind tobacco control in Australia. There's a paper he wrote called 10 Lessons in Public Health Advocacy. And one of the things he says, if you're going to be an activist or an advocate, such as myself, and many of the people who are involved in this discussion, he says, grow a rhinoceros hide. Because as soon as your work threatens an industry or an ideological cabal, you will be attacked, sometimes relentlessly and viciously. So be aware of that. It's not easy. It's been challenging at times. Lots of stuff going on behind the scenes that I'll probably bring out in a book at some point, which people don't know about. I mean, it's constant and it is relentless at times. But I still believe in the intrinsic goodness of the overwhelming majority of human beings. People hate injustice and people want the truth. And when you speak out, when you speak the truth, you'll be amazed at the amount of people that come to you, people you didn't know, or people who want to support you, or people say, you know what, I thought the same thing, but I was afraid to speak. Thank you for speaking out. I'm with you. So although there are many, I'm sure, powerful enemies that I have, but I don't think it's individual enemies. I just think it's a mindset. It's not, I don't think people are really attacking me. They're just, I think people are under the illusion of what they think is the way that they should behave, or what would give them, the best mental and physical health. I think that ultimately the truth is way more powerful, but you have to be able to, have a thick skin for sure.
That's for sure. You've heard of Dr. Andrew Wakefield, I know, because we've had a conversation about him. And I remember him saying to me that they published a study that showed essentially that their study had failed to prove a hypothesis. I don't remember the details of the study, but I just wonder, why is it so hard for scientists to say, actually, this didn't work, and we're going to publish the results of why this didn't work? This medication failed, and we want everyone to know. Why is that? Why don't we see the failures?
Great question. I think it's probably multifactorial. I think some of it is due to the fact that there is some of the illusion, I would say the illusion of knowledge is one aspect. So this belief that medicine is an exact science, and when it's not, nothing could be, it's not like physics or chemistry. It's an applied science, and it's more the science of human beings. And then science evolves and it changes. So I think that's one reason where there's almost willful blindness to accept that something may be contradicting the original findings. I think that there is a lack of being humble enough. We need more humility and less hubris in medicine to accept that things may change, and what you may have believed to be true at one stage, or you may have published as being correct, is proven to be false. And there's a fear, I think, there's an ego behind it as well. Stephen Hawking proudly, disproved his own original theories on black holes. We need more scientists like him. So that's one of the reasons as well. And then, of course, I think a lot of people's careers are then built often on a particular hypothesis, and then they just, it's human nature. People don't want to admit they're wrong. But the problem is, as you say correctly, science evolves, new information comes along. One of the things I talk about in my lectures is that 50% of what you learn in medical school will turn out to be either outdated or dead wrong within 5 years of your graduation. The trouble is, nobody can tell you which half you have to learn on your own. So I think if more doctors had that awareness, and also understood, Sally, that actually patients appreciate when things change. I was double vaxxed. I've changed my opinion in terms of how beneficial the vaccine is and what the potential harms are. I was one of the first people to help tackle vaccine hesitancy on Good Morning Britain, because I, at the time, did not think that there was even a possibility that the COVID vaccines could cause any harm, because traditional vaccines in general, compared to most drugs, all drugs are actually still the safest. So, but with my patients, I tell them if things change, I say, I was a prolific prescriber of statins without thinking about it. But then when I looked at the evidence, when I understood my patients weren't getting better or something was wrong, then I had to change my opinion. And I tell patients that, and they appreciate it. So doctors shouldn't be afraid to just be honest, saying, listen, I thought this at the time. I'm doing things in your best interest. Information has changed. It's my duty to tell you information has changed, and this is why we should be doing it. And I've never had a patient come back to me saying, oh, you were wrong, and why did you tell us wrong information? Just be honest and open. I think that's what we need, more doctors to be like that.
I think that's true. we are slightly running over, but there's two questions here that I really want to ask you.
Yeah.
One thing I should say about every doctor who's spoken today, not a single one of them have ever had a complaint from a patient. The complaints against them have all been from other doctors, from trolls, from who knows who, but never ever from a patient. So how do your colleagues respond when you talk about the effective capture of medical journals? Do many believe what you say?
Oh, well, listen, I mean, the evidence is there. So the good news is I give lectures all over the country to doctors, conferences. You know, I've been a trustee of the King's Fund that advises government on health policy. I work with the medical colleges. I've had roles at very high influential positions, or certainly having the ear of some of the most influential doctors in the country. The evidence is clear. So, you know, they get it, they absorb it. There's very little pushback from the majority of jobbing doctors at all, because it's very clear. But I think what happens is, you know, many will choose to stay silent when they should speak up. And then a lot of them don't know what to do. So they just carry on within the system. It's not easy to go against the establishment and the status quo. But many are more aware, and many of them are doing their bits to try and reverse this problem of worsening chronic disease by highlighting the issues that I've talked about. So, yeah.
And the last question, I love this question. Can governments be trusted to tackle corporate bias when there is massive lobbying?
I think it's harder, but let me put it this way. I've had conversations one-on-one with now 3 former health secretaries, okay? Very intimate, like as in, you know, conversations, very candid conversations with them. I know many politicians. I WhatsApp, text message several people who are cross-party, Conservative, Labour, etc. Many of them, they actually are there because they want to do the right thing, and they are just misinformed, and they are ignorant of the issues, and they're just hearing one side of the story. So it isn't so much, the conflicts are there, of course, but I think more of it is the lobbying, is that they're only getting one version of the truth, and they believe that to be complete, and they're not having people like myself or other people aren't necessarily getting the opportunity to give them the counter argument. So, but I think one of the solutions for sure, certainly in America, is that, you know, in terms of changing the law, which I talk about, we should have a law that they should not be allowed to lobby at all. There should be no lobbying allowed whatsoever by these sorts of industries. Certainly, political donations in America shouldn't be happening by, for party donations and that kind of thing from these big companies. It's extraordinary, absolutely incredible that this is happening. But what is the best way? And this is again proving harder at the moment to achieve. Mahatma Gandhi, I said, is one of my inspirations. One of the things he said, as I said, I believe most people are good. Most people want the truth, and most people hate injustice. Is if you want to create a revolution and change things, make the injustice visible. Make the injustice visible. But how do you do that? What's the biggest platform to do that? Mainstream media. Now, I know it's hard at the moment, but if we get through to a few, and social media is there, and we've got all these groups and stuff, the movement grows, the information spreads. We just have to keep pushing and don't give up, and we will get there, because this bubble is going to burst. And the reason the bubble is going to burst is because we're at a stage now where healthcare systems are completely failing, and people's health is worse than it's been in the last 30 years. And we are regressing in terms of our health. We're not progressing. So that bubble will burst soon. And the way it will burst is people understanding what is at the root cause of the problem. So we have to make sure we focus on people. We need to make sure that those conversations happen where people understand the root cause of the problem. And that is that the information that they're being given to make health decisions is completely corrupted.
Thank you for that, Aseem. Well, welcome to my newspaper. So today has been all the features that I haven't been allowed to write over the last 2 years. So I feel like, I've got this out of my system, and we can all move on and into our lovely world of functional medicine and integrative health. So thanks, Aseem.
Thank you.
I just want to say to everyone who is coming tomorrow, today has been so inspiring. Tomorrow will be just as inspiring, but so totally different. And I also want to say thank you again to everybody on the team, and that's Chiara De Michele, Julie Gunn, Elle Taylor and Rihanna Khan. And thanks to Philly J. Lay for allowing us to use your podcasts. And I know lots of you messaged to say they were really inspiring, and you can find Philly on the Apple podcast, and her podcast is The Wellness Way. She also has a website, phillyjlay.com, where you can sign up for a newsletter and get advance warning of her, or not warning, but advanced information about her podcast. So thank you, everyone. It was just so great to see everybody and to see your comments and to see how you were all really inspired by today. So hopefully I'll see you all tomorrow. Most of you I know I'll see on Thursday, but look forward to seeing you soon. Take care.